Hello and welcome to this week's edition of Health Talk. Now, today is day 79 of South Africa's national lockdown and also day 13 at level 3 in response to the COVID-19 pandemic. So what's coming up on the program today? Well, we'll be joined by the Director for Child, Youth and School Health from the National Department of Health, the NDOH, to speak to us about the impact on the routine childhood vaccinations during the COVID-19 pandemic. We'll also speak to the Communications Officer of the South African National Blood Service, the SABC, about the decrease in the South African blood service collections and the importance of donating blood during the coronavirus pandemic. Now, annually during June, South Africans celebrate National Blood Donor Month, and whilst countries worldwide celebrate World Blood Donor Day on the 14th of June, which is tomorrow, that's all still to come on the program though, and we'll chat quite a bit about that. I think it's something that you'll find interesting. But first, let's catch up with our senior producer, Zama Buthelezi, who'll take us through the latest South African COVID-19 numbers. Top of the morning to you, Zama.
A very good morning to you, Peter, and our viewers. Just over 1 million tests have been conducted in South Africa amid reports of global shortages of COVID-19 test kits, as well as backlog at both our country's public and private laboratories. Let's take a look at the national COVID-19 statistics. 1,060,425 cases have been conducted nationally. 61,927 positive cases have been recorded. 35,008 recoveries have been recorded, but regrettably 1,354 people have since passed on because of the COVID pandemic. 25,565 active cases have been recorded so far. During his visit to the Eastern Cape, Health Minister Dr. Zweli Mkhize spoke, among other things, about the country reaching the 1 million mark in testing for COVID-19. Let's listen to the minister.
Today we've reached the landmark of 1 million tests that have been done in the whole country, both in public and private. That doesn't mean that's enough. It just means that when we have challenges, we must not undermine the fact that we've done a lot of that. And at this point, I do want to pay tribute to the laboratory staff, both in the public laboratories and the private laboratories. In particular, I also have to pay tribute to the nurses, the doctors, and all the professionals who look after the patients, who have to be the first person who has to take the risk of saying, I'm going to look at this patient in the eye and say, I suspect you have this infection, let me do a test.
Let's take a look at the provincial statistics update. Regrettably, 1,005 people have since passed on from the COVID-19 pandemic in the Western Cape. And sadly, this province is also leading when it comes to infection numbers at 38,926, Gauteng following at 8,781, and the Western Cape, not far from Gauteng, at 8,615. Gauteng was once the epicenter of the COVID-19 pandemic and now the second when it comes to infection, with the overcrowded Johannesburg inner city named a hotspot, recording the highest infections for 2 consecutive weeks. Let's listen to what Premier David Makhura said while giving the update on COVID-19 pandemic in Gauteng this week.
The pandemic is gaining momentum in Gauteng province. And that's the critical message I would like to send on behalf of the Gauteng provincial government, that the pandemic is gaining momentum in Gauteng province. And we've got to face this reality head on. And where there's no compliance, we would like to send a very strong message out there to our communities, to workplaces, that this completely will undo any gains we had made during the lockdown, especially during the full lockdown, those 34 days where we made significant gains. and the additional 31 days where we also were able to slow down the pandemic.
Let's continue with the positive cases in our provinces. KwaZulu-Natal has recorded 3,573 cases, the Northwest Province at 865, Free State at 435. Let's continue with the other provinces. Limpopo recording 288 cases, Mpumalanga at 243, the Northern Cape recording the least at 138 cases. COVID-19 symptoms include fever, coughing, sneezing, and shortness of breath. If you believe there is a chance that you may be infected, call ahead to speak to medical help from your health provider or use the public hotline 0800 029 999 and alert them to your symptoms. Government urges all of us to continue observing lockdown regulations, practice precautionary measures by washing our hands with soap regularly, use sanitizers with 70% alcohol content, and wear masks when leaving the house. Wash these masks with soap and water after use. Stay at home. If you have to go out, observe social distancing all the time. This is just to make sure that we keep ourselves and others safe and healthy. Thank you, and back to you, Peter.
Zama, thanks very much indeed. Now, there's some pretty steep statistics there, but do remember that as we observe and report on the COVID-19 cases, the numbers can change, and sometimes they do quite significantly. Remember, you can also be part of the show and you can ask questions from some of our guests, what's on your mind, or you could simply share your views on some of the issues that we'll be discussing today. And the number to call is Johannesburg 011 714 6841, 011 714 6841 or 6842. We really look forward to hearing from you a little later. Now, South Africa and countries around the world are facing the challenge of increased demand for care of people with COVID-19, and at the same time, fear, misinformation, anxiety, limitations of movement have disrupted the delivery of healthcare. Today we discuss two of these essential health service routines, childhood vaccinations and blood donations. Now, question for you this week is, how has the lockdown impacted on you and your family's health? Have you been able to keep to all your medical checkups as well as mandatory medical requirements? Send us your voice notes or video messages to our WhatsApp number, and that's 065 862 4548, 065 862 4548. And please try and keep your messages short, under 30 seconds each. You can send us a video or actually audio message as well. Don't forget, you can also share your thoughts with us on social media via Twitter using the @SABC Health Talk or hashtag SABC Health Talk, or you can land on our Facebook page, SABC Health Talk. I'm Peter Ndoro, and Health Talk continues right after this.
When the COVID-19 health crisis began, most people stopped going to the doctor unless they were sick or injured. That included families who chose to postpone their children's vaccination appointment.
People were afraid to come, and because we were trying to have social distancing, therefore the amount of mothers who were coming, we find that they were not as much as they used to come.
According to a report by the WHO, vaccination rates have dropped since the start of coronavirus outbreak.
It's affecting thina kakhulu singabomama because we have to skip immunization abantwana bethu. So now we have to come a clinic every month for immunization because we are behind 1 month for ukuthi umntwana athole immunization. So now I have to come every month for ukuthi umntwana athole i-immunization yakhe yonke iphelele.
It sets so many things back because I'm here today, but I'm not supposed to be here. It's because of the corona. If not corona, I will not be here. I have been finished with the immunization for because I got 2 sets of twins. The first one 3 to 6 years, and the second one 1 year and 6 months. If not because of this corona, I will not be here today. But because of the corona, it delayed.
It has affected us. There were long queues, and we get immunization late.
Well, it has affected us because during lockdown, when the president said the lockdown will start on the, 20-something. So we were told to go back, and then, by that time it was still not yet cold, but now it's cold, so we have to come early with the children, and they may get flu.
Pediatricians want parents to know that putting off immunizations create more health risks.
When the mother brings their children for immunization, we are preventing diseases that can affect their children, that can also kill the children. For example, we have vaccination that prevents pneumonia. Pneumonia being the highest killer of the babies. But for now, we are seeing it reduced because of vaccination.
Now, as many as 80 million babies are at risk of disease such as diphtheria, measles and polio due to disrupted vaccinations worldwide. That's a stark warning from the World Health Organization, UNICEF and Gavi, the Vaccine Alliance. They say that routine vaccination efforts have been substantially disrupted in 68 countries due to the COVID-19 coronavirus pandemic. So what's the situation here at home in South Africa? Are our children at risk? Well, let's find out from the Director for Child, Youth and School Health at the National Department of Health, Ntombi Mazibuko. Thanks so much indeed for joining us, and welcome to the program. All right, let's start by just getting a sense of how COVID-19 has affected the situation in South Africa in terms of vaccinations.
Good morning to you and to all the viewers. In South Africa, the situation, I think it's not different from the other countries which are also affected by COVID-19. When the lockdown started in March, we then look at our data and we also look at our April data, comparing it with the April data for the previous financial year, that is 2019-20 and 2018-2019. We have seen a huge decline, especially during April this year. And understandably so, because we know when the lockdown started, there was no public transport, mothers had to walk to facilities. But I think we're all in a panic mode, and we didn't know whether to continue with vaccination. And some facilities, they then indicated that no mothers must come on a later day. They're not giving immunization and so on. So we've seen a huge decline, and it's a concern to us. But once we have children who are not vaccinated, especially for things like measles, we are inclined to get outbreaks. And we know that measles is one of the diseases in South Africa. We've also managed getting children from measles because we're vaccinating all our children with measles. But the decline that we've seen in April, it is a huge concern to us, and we are trying to address them in various ways.
Ntombi, we're going to just pause for a moment because we're having challenges with the line. So just hold on for a second. We're going to try and redial you because I think what you have to say is quite important. So we're going to try and get her back on the line just now, just so that you can hear all of this, because a lot of what she's going to be saying affects so many of us. And I think a lot of you have children, infants, and that first year is always quite important. And don't forget, if you want to share your thoughts with us, perhaps ask a question, you can always call in. And let me just give you that number again. It's 011 714 6841 or 011 714 6842. So if you've got a question perhaps for our Sintombi, please dial through, because this is quite an important time. I think there's a lot of misinformation. Some parents might not really have an understanding of why it's so important to be able to take your children to get immunized. And you'll know that immunization is one of the greatest disease prevention tools that we've invented in history. And so we've got to make sure that our kids get immunized. And if there's some concerns, some confusion, or something that you don't quite understand, then please use that number, 011 714 6841 or 6842, and we'll try and get your questions answered for you. All right, we're going to take a quick break, and when we come back, hopefully we'll have our Sintombi on the line for you. Stay with us. Welcome back. You're still watching Health Talk. Now, just before the break, we were trying to talk to the Director for Child, Youth and School Health from the National Department of Health, and we were speaking to Ntombi Mazibuko about the situation regarding vaccinations, and that's been severely hampered around the world. And the WHO says that as many as 80 million babies could be affected. And we're trying to get a sense of what the situation is here in South Africa. Let's join Ntombi Mazibuko once again. Thanks so much indeed for persevering with us. So the first question that I asked you was, how has South Africa been affected? We're seeing this worldwide phenomena, 68 countries measured so far, as having problems as a result of COVID-19 in terms of immunization. Is it the same here in South Africa?
Thank you again, Peter, and good morning to all the viewers. South Africa is not different from all the countries that are affected by COVID. We have also realized that most of our services have been affected, especially immunization when we are looking at children. When we look at our April data compared with the data that for April the previous financial years, we have seen a huge decline, especially in immunization for things like your measles and your polio, which means that probably caregivers were not able to access services due to various reasons. When the lockdown started, we know that there were issues with public transport, and facilities were also trying to prepare themselves of how to manage the pandemic. So it resulted in provinces, some of them issuing letters to say services will not continue. So it was not formally in provinces, but healthcare providers themselves, they were giving mixed messages to moms and caregivers. So we've seen a huge decline, which is a concern. And as the National Department of Health and the provincial colleagues, we are now trying to find ways of addressing it. Because if we don't vaccinate children against the vaccine-preventable diseases, we might end up with outbreaks, especially measles outbreaks, because that is usually what affects us mainly in this country. South Africa, we have achieved a lot of successes. For example, we have been declared as a polio-free country because of our immunization. We have eliminated tetanus because of our immunization schedule. But now if we get children not being vaccinated accordingly and properly, then we might end up having outbreaks, which is a huge concern. And we need, as a collective, to make sure that we vaccinate children according to the schedule and at the right time.
All right, so you mentioned transport, you mentioned misinformation or mixed signals. Could fear also be contributing to parents staying away, that they're scared to catch COVID-19?
We think so. Fear also might contribute to that. But as healthcare workers, we are supposed to communicate the right information to moms and caregivers, because we have got information now. We need to communicate to them to tell them that it's right to come to the clinic to vaccinate your child. All what we need to do is to make sure that you take the necessary precautionary measures. Yes, I can say probably fear, but we also need to play our part and educate moms that it is safe to come to the clinic. The one thing that we're also trying to address is to make sure that, because what happens, moms will all go to one clinic at the same time, and you find that we have long queues and facilities are congested. We are encouraging our healthcare providers in facilities to implement the booking system, because it is part of our ideal clinic. So if we start implementing the booking system correctly, that also reduces queues and also reduces the number of people who are in a facility at a particular time. We also received some recommendations. In fact, let me not say, we received recommendations from, we have a group in South Africa, which is the advisory group. They advise the minister on issues that relate to vaccines and immunization. So they sent recommendations to national, which we shared with provinces on how to go about to make sure that immunization services continues in all facilities. They made a lot of recommendations, which provinces are now developing plans to implement. And one of the main things that is mentioned in those recommendations is implementing the booking system, because that will reduce the number of people in a facility at a particular point in time.
All right. You know what? We've got some people that are already calling that perhaps might have a few questions. So let's just take some of those calls. Let's start. I think we've got Colleen on the line, from Nicolene from Gauteng. Nicolene, a very good morning to you. Do you have a question or something you'd like to say?
Yes, good morning, and good morning to your listeners. I just want to find out, my son went for a vaccination. It shows on his card at 6 years, right? For his 6-year vaccination. But then it was scratched out and signed. And on the side it says 12 years. So I asked the clinic, did he go for his vaccination at 6, or should he go now when he turns 12 in August? So I'm not sure, because you cannot get a double dose. So what do I do in this case?
All right. Do you know what vaccination it was?
At 6 years, it says the tetanus, and yes, the polio vaccination.
All right. Okay. Let's get an answer for you. Asintombi, I don't know if you can answer that. She says that did you hear the question?
Yes, I did. Thank you.
Okay. So what can we tell her?
Thank you, Nicolene, for that question. I'm not sure how old is your son now.
He's going to be turning 12.
Yeah. So my advice would be, because now your son will be turning 12, he will be getting we call it TD, it's tetanus diphtheria vaccine at 12 years. So rather take your son when he turns 12 for that vaccine at 12 years. It means your son missed out on the 6-year-old one, which is fine, but then he will get the booster, which is supposed to get when he turns 12. So take him back to the clinic when he turns 12. Thank you.
All right. Okay. Just talking about the size of the problem that we might have. I mean, I think about 1 million babies are born a year now. So if we get a substantial amount of those children not being immunized, we could have quite a serious problem downstream.
Definitely, it's true, Peter. And in fact, we get about 1.2 million babies born every year. And in South Africa, we have never managed to vaccinate every year more than 95% of those babies. So it means we've got quite a number of babies who have not been fully vaccinated throughout the other years as well. So if this is, then it becomes a cumulative problem. So if we don't now vaccinate, and as we're looking at our April data now, I think I've indicated that we've got some provinces where their vaccination levels is standing at less than 50%, which is a huge challenge. So we need to catch those babies and make sure that we vaccinate them to prevent us getting any outbreaks, because once you don't vaccinate your children, then it means you lose your herd immunity. And WHO recommends that for us as countries to have herd immunity, we should have at least 95% of our children vaccinated against measles. Then we'll be in a safe position. As a country now, it means that we are not in a very safe space, so we need to make sure that we catch up all the babies who have missed immunization, especially during this COVID pandemic. Because you can imagine if we get an outbreak of any vaccine-preventable disease now when facilities are dealing with COVID-19, it's going to be a huge challenge. So we really need to make sure that we use whatever resources we have to catch up on the children that we have missed.
All right, so who are the most vulnerable? Is it that first year, those infants from 0 to 1? And when are the other immunizations due that parents should really be keeping track of?
So the most important vaccines that we give, we call them the primary vaccines that we give during the first year. When a child turns 1 year, that child should have received all the primary vaccines, so that those we call, if they've received all, we then say that the child is fully immunized for the age. But then at 12 months, the most important vaccine that the child gets is measles. And we find that our measles coverage at 12 months is very low. We're sitting below 80%. We're supposed to be at 95%. So it means as the child gets older, caregivers and parents now they relax, they don't go back to facilities. So that's why as a department we've got a huge responsibility to play to make sure that we keep on educating moms to make sure that it's important to vaccinate. The next vaccine after 12 months is given at 18 months. Even when we look at that one, most children are not getting that 18 months immunization. But luckily, what we have done now as a country during 2019, we conducted what we call an immunization coverage survey in all the districts. And we also, in that survey, they also find out the reasons why babies are not fully immunized at a particular age. So once the minister launched the report, we are going to implement interventions to address the gaps which have been identified during the survey. And one of them is that mothers are not given reminders on when to come back to the facility. So we need to work on that. But the other important thing is the demand creation side. We are not communicating all the time with caregivers and mothers, and it's important that we keep on communicating with and reaching out to them.
All right, and perhaps one of the questions that we can start wrapping up with, some parents might be scared about infants in particular getting COVID-19. What do we know about babies and infants being exposed at clinics to COVID-19, especially when they haven't had many of their immunizations? So what danger are they in?
I think it is important that all of us to make sure that we adhere to the measures which have been given to all the public people. Make sure that you wash your hands, keep a safe social distance, the 1.5 meter, you wear your mask all the time. Especially moms, when they go to facilities, they should make sure that they adhere to those measures. But also, at the same time, healthcare providers in facilities, they also practice infection control measures to make sure that they don't put the baby's life at danger. If we all practice these safe measures, I think the baby is much more better getting vaccination than not, especially during the COVID-19 situation, because the baby might not get infected, but the baby might get a vaccine-preventable condition, which could have been prevented if that baby has been vaccinated.
All right.
So we advise moms to take the necessary measures, but to go to the nearest facility. And clinics are implementing measures in place, like making sure that babies are kept aside, they are vaccinated, they are attended first, so that the mothers don't wait for a long time.
All right, and very quickly, when a mother is breastfeeding, if she suspects that she's COVID positive, she's in quarantine, is breastfeeding still okay?
Breastfeeding is the best thing that the mom can give to the babies. And in fact, we have got guidelines which people can also access through the NICC website on breastfeeding. That it is safe to breastfeed, but you need to make sure that you take the necessary precautionary measures, hand washing, wearing a mask, but the baby's best thing that you can do. In fact, the best thing that you can do for this particular infant is breastfeeding. So moms should continue to breastfeed, and if she's not sure on what to do and she's very sick, then she needs to go to the nearest facility. But breastfeeding is the best thing to do.
All right, we're going to have to leave it there, but thanks very much indeed for sharing those insights, and let's hope the message continues to get out there that even before COVID-19 we had an issue in terms of getting our children immunized 100%. Let's try and get those numbers up, particularly during this difficult time. Thank you so much indeed for joining us, and have a great day.
Thank you.
All right, that's Ntombi Mazibuko, who's the Director for Child, Youth and School Health from the National Department. And get your kids immunized. That first year, critically important issues such as measles are things that we really don't need to deal with anymore because there are vaccines available. All right, let's catch you up with what you've been saying on social media, and I think some WhatsApp messages have come through. In fact, let's start with Twitter. Sianda Mda says, I think that for most people the routine was distracted by this pandemic, especially at the beginning of the hard lockdown. They could only attend to their health as a matter of urgency when things got unbearable. From WhatsApp, we've got, yes, I've done all my medical checkups as usual, from Volvo Rauka Umzimkul. Thank you so much. My sister missed her appointment. Now she must call the hospital to get her new date. Yeah, look, it's never too late. I think let's just make sure that you go, even if you've missed those appointments. Good morning. Unfortunately, my spouse is still in Gabon and have no medical requirements. He was supposed to fly home on the 26th of March, but due to the lockdown, he's still stranded in Gabon. I've got a real bad impact on our lives. Nevertheless, our God will foresee. God bless. Yes, we wish you the very best indeed. Stay safe and make sure it's never too late, by the way. If you've missed your dates, whatever they might have been, it's better to go late than never. All right, after the break, we'll be speaking to the communications officer of the South African National Blood Service, the SANBS, Kensani Mahlangu. Stay with us.
Colette, thank you so much for talking to us. Tell me the incident that saw you going to the hospital having to receive blood. What happened and when was it?
So it was January of last year, of 2019, and as you know, as we typically do, I was ignoring my body's messages to me. I mean, I was suffering at the time of anemia, which I was just ignoring. I hadn't gone and had it checked. Lots of breath, lethargic, etc. And that was over a period of about 6 months, until literally on the day that I went through to my doctor, I couldn't even walk 5 steps without having heart palpitations. It was just so bad. And my father rushed me off to the doctor, and they tested my blood and realized, as my GP said to me, he didn't even know how I was still alive. My iron levels were so low. And they literally had to then put me straight onto a blood transfusion. So this was obviously the first time I'd never even thought of the option of ever having to need blood. We all live with our heads in the sand. And then I also have quite a rare blood type. So what happened is I needed 3 units, and the blood bank wasn't even able to provide us with 3 units, which was obviously a huge scare for us.
I hear about how it impacted badly on you and everything. So since then, are you donating blood? And how long after the incident did you start donating, if you are doing it?
Thankfully, I had the most incredible specialist. My doctor really, literally saved my life, and he was incredible through my recuperation process, which I also then had to have operations, etc. And I gave my commitment to him and said, if you can help me get to the health level where I can donate, because obviously your iron levels have to be a certain level in your body before you can donate, before it's safe. And it literally took him a year up to January this year. So it was literally 1 day short of a year's anniversary since my collapse, where he tested me and he said, actually, now you're healthy enough. So, he took care of me for that year to get me to the level where I could actually then start donating. And I just felt it was so important. 3 faceless people saved my life, and it was now my turn to do my part. So 30th of January, on my anniversary, I literally went and I made my first donation, which, I can't even begin to describe. My emotions, I didn't expect to be so emotional. But just remembering a year back how I felt receiving somebody else's blood, I just felt that it's now my duty, and also to advocate for the SANBS. It's important. The work that they do is just so vital, And then literally 2 weeks ago, I did it under a very safe COVID-19 restrictions. It was my second donation. And again, I felt so empowered, that even in these troubled times, somebody can benefit from my experiences from last year.
But how do other people feel about donating blood during the COVID-19 epidemic?
It is safe as long as bona bazosebenzisa sanitizer, then bagcoke ama-mask, because like other people, they are dying at the hospitals, they need blood.
Mina ngicabanga ukuthi kubalekile ukuthi abantu basizane ngoba mabeyenza leyo nto uyakwazi ukusiza omunye umuntu.
Ngicabanga ukuthi akukho safe because abantu abanye abakho right, abanye ba right. Sizosuka sithelelane imikhuhlane eminingi.
All right, so powerful story there, just to highlight the importance of blood donation. Thousands of people would die every day if they didn't have access to quality blood when it's needed. Just 1 unit of blood donated provides different blood components that can help up to 3 different people. So blood sadly can't be manufactured, and so donation is the only way to build up the life-saving stocks that are required. And again, it's unfortunate, despite the grave need, very few people are actually active blood donors. And with each stored unit of blood having a short shelf life, regular donations are essential. Well, to talk to us a little bit more about this, we're now joined by the Communications Officer at the SANBS, Kensani Mahlangu. Thanks so much indeed for joining us. Welcome to the program.
Thank you for having me, Peter.
All right, so this morning we've been seeing how a lot of important services have been disrupted by COVID-19. Immunizations is one of them. Has blood donations been affected as well?
So coming into the lockdown period, we were very concerned about blood donations. We had mass cancellations of blood drives, which was actually quite concerning for us. However, we did pick up, I think, about 3 weeks into lockdown. So we will remain stable throughout the lockdown period. But what we are experiencing now is that as people start to reintegrate into the offices again, we have less people now coming through to the donor centers and donating blood.
I would imagine that you've got a core of people that are regular donors. Just how active are people in South Africa in terms of blood donations? Do you have any idea?
So the scary part is that only 1% of people who are eligible to donate blood are currently blood donors. So this means only 1% of South Africa is then servicing the needs of the entire country, which you can imagine is quite worrying.
Yeah. And once you've got this donated blood, how long can you store it for, just to get a sense of why regular donation is important?
So it varies per component that you are then able to donate. So we can store plasma for, I think, a bit longer, as well as platelets, than we would whole blood, because then we can freeze plasma, which lasts a bit longer. So I'm not quite sure then of the specific periods of time, but this is why then we need people to come in every 56 days to donate whole blood, and then every 2 weeks for plasma and platelets.
All right, so, some of the things that we like to do on programs like this is to get rid of all the myths and the tales that are out there and fears. Can you get COVID-19 from a blood transfusion?
So fortunately, the current evidence that we have suggests that you cannot get COVID-19 from a blood transfusion. I think it is supported by the science that respiratory diseases don't commonly live in the blood. So we can assure you that you cannot get COVID-19 from a transfusion.
And how safe is it to donate blood? The facilities that you have, am I at risk if I come to donate blood?
So by virtue of leaving the house, you're already at risk, Peter. But I think we can assure you that our donor centers take extra precautions in terms of ensuring that everyone is safe. So we screen our staff daily in the morning and in the evenings, just to make sure that they're still as healthy as they came in. We also screen our donors, so we make sure that you don't have any signs of illness at the moment. We make sure that everyone is always wearing their face masks. We provide sanitizer. We distance everyone from each other physically. So we're doing over and above what is required to make sure that everyone is safe.
All right, so we're going to get a few calls as we're talking. So let's go to Dawn, I believe, who's in East London. Dawn, thanks very much indeed for calling in. Do you have a question or something you'd like to share?
Yes, please. When my grandson was in school, they came around asking for blood donors, and he immediately applied to become one. So he's been giving blood for a few years now. He's now 19. I wondered if they were still taking blood during this pandemic, and if they are, if it is safe to donate blood.
All right, okay, thanks.
He's in excellent health. He does have a fairly rare type of blood.
Fantastic. Thanks so much indeed, Dawn. All right, so I think you've sort of partly answered that, but just to reassure her, is it safe to donate blood at this time, and are people coming through enough?
So people were coming through. I think I did mention that we are then experiencing people less able to visit donor centers as they've gone back. So we would encourage Dawn's grandson to resume his donations. I think it's completely safe for him to go in. So what we have done was create mobile blood drives. We were able then to reach people who are not close to a donor center. We continue to do that. We did have challenges with venues during the lockdown period, but I think as everything opens back up, we'll be able to reach more people. But I encourage everyone to continue donating.
All right. Take us through the process of checking blood, because it's one thing to donate, to receive, but before you put it out into the bank, there is still a testing process that happens, isn't there? So I would imagine even if somebody comes in with a condition, COVID, whatever, there's still a process of making sure the blood is safe.
That's true, Peter. So we test every single unit of blood that we receive. So irrespective of if you are a new donor or if you've been donating for many years, we test every single blood unit. We test for common illnesses that are traceable in the blood. However, our systems are extremely sensitive. I cannot speak specifically to what all we do test for. However, we do have a feedback system as well for our donors. So if we do detect any abnormalities in your blood, anything that you would then need to contact a physician about, we will contact you, we will counsel you, and we'll help you through the entire process.
All right, so we've just heard from Dawn. His son's been donating, I think, since he was 17. What is the age range for donations, people who are thinking perhaps of becoming donors?
So typically we take blood from people between the ages of 16 and 75. So I think she did mention a very important note that he is in good health. So that is one of the requirements. You have to make sure that you're in good health. You need to feel healthy on the day and have had a meal. We take blood from people over 50 kilograms in weight as well. But I think as she did mention also that her son is he has a very rare blood type. So for those people, we encourage the donation of plasma and platelets. So if anyone between the age of 18 and 65 is then able to donate plasma or platelets with the rare blood types, that's also always one of the best things to do.
All right, so just remind us again which ones are the most rare ones. I think I'm A positive, which is not terribly rare. So which ones are the ones that are shortest supply that perhaps people, if they know, could perhaps step forward a bit more?
You are in the rare blood type group, Peter.
Really?
So it's A and AB are the rare types, yes.
Wow. Okay, so which other ones are there? So just if somebody is that blood type, that they can step forward?
So blood groups are generally fall between A, B, and O. Right. So there are different variations of those different blood groups.
Okay. All right, so you're at 1% at the moment. For you to be happy, at least what percentage of donations should we be getting from our population being active?
We'd love 100% from everyone who's eligible, but I think that is not achievable. However, we just always are aiming to keep our blood supply stable so that we can service everyone who needs blood at all times, at any given time actually. So I think one of the messages I'd like to drive in today is also to encourage people to come in and donate plasma and platelets, because those stocks do also dwindle, and I think that also caters to important therapies for chronically ill people. So we encourage donation of whole blood, plasma and platelets, not just the blood.
All right, and then the process itself, is it relatively painless? Are you going to bribe me with a sweet? How does take us through a donation?
So we're not going to bribe you, Peter. I think we always try to drive back the message that blood donation needs to be a voluntary process. You know, we don't want to then incentivize you to come and donate blood. So the process includes you doing a basic self-exclusion test at home. You just make sure, am I feeling better? Am I feeling well, rather? Have I had a meal? If you tick all those boxes, then you come into a donor center. At the donor center, you'll answer a questionnaire that also ensures that you're healthy enough to donate blood on the day. If we do feel like you might not weigh enough, we'll weigh you and we'll do additional checks as part of the mini medical. Then after that, you're good to donate blood. I think it's just a needle prick. It's nothing really hectic, nothing painful. Literally anyone can do it. You can sit through it. It's very fast as well, so we do not take up too much of your time.
How long is it typically?
So typically for whole blood donation, you would expect to sit for about 15 minutes, depending on how quickly you bleed. And then for plasma and platelets, it's an entire process where we put your blood through what is called apheresis, where we have to separate your red blood cells from the plasma or the platelets. So that would last anything up to an hour.
All right, and that's where we're going to leave it. Kansani, thanks so much indeed. Let's hope the word gets out and people come out in their numbers, because it is life-saving. Thanks so much for your time.
Thank you, Peter.
All right, that's Kansani Mahlangu, who's the Communications Officer at the South African National Blood Service. Just 1% of South Africans donating blood. Let's try and double that in the first instance, because you are saving a life, and you can help up to 3 different people with just 1 unit of blood. And that's where we're going to leave Health Talk for this week. Thanks so much indeed for joining us. Please do all the necessary social distancing, wash your hands, stay at home as much as you can, and wear your masks. Be safe. Let's protect each other. Take care, everyone.
Employers who are unable to pay the full salaries of their